Pillar 3, collaborations. Collaboration means that Student Health Services is more than just a building on campus or a single department. The Student Empowerment Academy engages students to provide classroom presentations regarding all of the health services offered on campus. Through their participation in the Student Empowerment Academy, students can help plan large events with outside speakers and work with teachers on how to promote health and wellness through extra credit assignments.
One of the most recent projects I've been honored to work with Student Health Services on is the Student Empowerment Academy, which it's actually been one of our biggest on-campus collaborations. We have student employees from Disability Resources, CalWorks, our success coaches, our student ambassadors, our student health assistants, our peers, which are our mental health students. And we all come together, and Student Health Services, in partnership with these other departments, created a really comprehensive training program that embedded the principles of health and wellness in basically a program that's going to be offered to all student employees. So this really kind of speaks to their ability to leverage existing needs and turn that into a positive. Student Health Services and Student Equity are really great partners in achieving student success. I would encourage any California community college to reach out to their Student Health Services and explore the idea of utilizing equity funds to help increase access and close the opportunity gaps that are present on our campus.
We ask in our intake form how students find out about student health, and the number one referral source was faculty and staff. We actually have a lot of, I call them faculty champions on campus, that when we're putting on an event, we know they let their students know about the event. Often they'll offer extra credit. Some faculty will say, if you go to the peers workshop on suicide prevention, I'll give you 10 extra points. And that really helps because, again, the challenges of a community college where students don't live here. So for them to come to an event at night, that little push, faculty giving extra credit is helpful. We have a few different online resources which really lend themselves to be either assignment or extra credit. For instance, Cognito, it's an online training for how to support a student who may be in distress. That's a great one for an assignment because a student does it on their own, on their computer, and then they print out a certificate. So a lot of faculty will either do that for extra credit or an assignment. We also have Student Health 101 magazine as an online resource. I know some faculty have assigned read an issue and write about one of the articles or share a reflection. We've also been successful getting some of our health promotion work infused in the curriculum. We teach QPR suicide prevention, and now the nursing program and some different health courses have that integrated. So it's actually in their syllabus, so we know every semester we're going to go to that class. For 8 years now, we've worked with the county both on putting on some of these larger events, like when we've had a guest speaker talk about suicide prevention. We work closely with their mobile crisis team, who sits with us on our crisis intervention team, and we know that they can come to campus. Sometimes we have a student in distress who may need to be transported to the hospital, and the county mobile team can come here, do an assessment right here on campus. Another great collaboration we have is one of our peers sits on the county mental health board. They go to the monthly meetings, they provide that student voice for the county, and it's also a great learning experience for them to understand, it's a little bit more like learning about policy and budgets and the bigger picture of mental health in the county.
Health insurance is a critical piece of staying well because we can do so much here in terms of episodic care, and then if they need additional services, they need to have that health insurance. So Santa Rosa Junior College, we had about 50% of our students had insurance before ACA, and then now we're looking at 85% of our students have insurance, which is great. And we worked with the Redwood Community Health Coalition here in Sonoma County, which had all the health centers involved and got about 40,000 more individuals on Medi-Cal and insurance, which was a great accomplishment.
At Santa Rosa Junior College, these 8 pillars provide a strong foundation that structures all aspects of student health. These 8 pillars are designed to help create a healthier and more successful student community.